Please welcome Jim Messina.
Hello, my name is Jim Messina, and I am very proud to be here today to be the moderator for the panel about media and its role in changing and encouraging transparency in the patient safety movement. I was proud to be President Obama's Deputy Chief of Staff during the healthcare fight and help pass that bill, and then I ran the president's reelection campaign. After that, I said to a friend, I just want to do big, game-changing things. And that's when I met Joe Kiani in the patient safety movement. And I'm proud since those days to really be a partner in what I consider one of the most important fights that I will ever be involved in. Today we have a real dream team of journalists who every single day shape the coverage. And last year we did a similar panel, and it was the #1 most best reviewed panel, because these guys are going to talk to you about how they make the decisions on what to cover, what they think their role is as journalists, and how every single day they are shaping the news coverage of these issues. Here's some statistics to think about. When I was growing up, everyone got their news from 3 broadcast television stations, NBC, ABC, and CBS, right? You were a Cronkite, you were a Brokaw family, or you were a Rather family. Now, every single night, 16 different people have a share of the nightly news. The #1 most watched news network before the 2014 presidential or midterm elections was, someone shout it out. No. Univision. Univision was #1. #2 was Fox. #3 was Comedy Central. That shows you, right? That shows you the changing media landscape that we are dealing with every single day. Think about it this way. The average American now gets 2 million ads a year in front of them. They now turn to 2 sources to figure out what to do with all those things. Those 2 sources are your friends and family and neighbors and the media. The 2 places you go to try to figure out how to process all these things. Think about it another way. Of the 5 biggest social media networks, 2 of them didn't exist 2 years ago when the president won re-election. Think about it this way. When he ran for the first time in 2008, the smartphone didn't exist. Twitter hadn't been invented. And now all these things 6 years later are predominant. The other thing to think about is the role of journalists is under increasing fire from ratings. Network cable news is at the lowest it's been in two generations. People are getting more and more of their news from social media. In fact, social media news overall readership has exploded in the past 5 years. More people are actually interacting with news than ever before, but they're doing it in different places that they go to. And that's why this amazing dream team is going to talk to you about these things. So with that, I want to invite our panel up, and we will go straight at it. How are you? Good to see you. How are you? Hello. Hi. Good to see you. Gotta come to you. Hey, good to see you. How are you? Hello. Thank you. Okay, I'm going to quickly ask everyone to take 20 or 30 seconds to introduce themselves and tell you what their role in this whole world is. We'll start with you.
I'm Avik Roy. I'm the opinion editor at Forbes. I also actually play roles in the think tank and politics world. I'm a senior fellow at the Manhattan Institute, where I work on healthcare reform, and was a 2012 advisor to the Romney campaign, where we could have used your help.
I'm Kristine Cane. I'm patient advice reporter at U.S. News and World Report, and I cover a broad range of medical issues, conditions, and procedures, and patient rights and safety issues there. Happy to be here. Thank you.
I'm Lindsey Dunn. I am a managing editor with Health Forum, which is a division of the American Hospital Association. Our main publication is Hospitals and Health Networks, so it's the flagship publication that all our institutional members and their leadership receive.
I'm Diane Perez. I'm a physician, and I've been working for 20 years in the media for Televisa and Univision. And I'm a news anchor and medical correspondent for Televisa and Univision.
Hi, I'm Merrill Goozner. I'm the editor of Modern Healthcare. For those, probably most people know it, it's the trade journal that covers the mostly hospital space, but we've actually expanded to cover almost all of healthcare. And of course, we have a very active online presence at modernhealthcare.com.
Hi, my name's Arefa Cassoobhoy. I'm a physician and a medical editor at WebMD. And I'll clarify, a lot of people don't realize there really are doctors that work every day in the office at WebMD. I'm a part of the all content creation from the brainstorming table till it goes live. And I help make sure that the information is medically accurate, it's timely, and we keep the consumer first in our mind.
Great, let's go right at it. I have this trusty little iPad. If you have questions, you can send me the questions and I will ask as many as I can. I have a few of my own. Arefa, I'm going to start with you.
Yeah.
Too often media coverage about patient safety is about catastrophic events. How do we get to a place where we're covering the overall goals and make that more interesting and get away from the day-to-day headlines?
Right, well, I think that the key with reporting and bringing health information to the public is really about patient empowerment. So for me, the focus is health education. And we want the patient to really understand their illness, understand the processes of treatment, understand what their options are. And it's not about self-diagnosis or self-treatment, but ultimately let the patient be able to do their homework before they meet the provider, after they meet the provider, and then again for all the multiple visits to healthcare facilities, and allow that conversation to be richer.
Merrill, you want to?
Well, it's interesting. We're in a year, just coming off a year where we had a major catastrophic event that everybody paid attention to, which was the misdiagnosis of a patient down in Dallas with Ebola. And that triggered a big nationwide coverage of healthcare safety in a way that probably had never gotten attention before. From our vantage point where we sit, we cover it all the time, and we cover it in much broader issues. In fact, I was thinking, I brought it for a reason. When, that happened down in Dallas, our cover is about ill-prepared, and it says, we made mistakes, and below it says, they're not alone. And the point is that we didn't cover it as a one-off event. We covered it as a systemic failure. And in fact, there was some talk this morning in the Ebola panel about how preparedness, attention had dwindled, the former Surgeon General said. But in fact, if you actually track the budgets, which we did, actually money has dwindled as well. And so what you see, I think, in our coverage, especially from the mainstream media, New York Times, Wall Street Journal, where they should be more systematic in their coverage, and I think years ago used to be, that they've gone to a more episodic kind of approach too, and failed to cover this as systemic issues. And so you're seeing really only people like us in the trade press who are giving it that kind of attention.
Anyone else want to weigh in on this one? All right, let me turn to you, Avik. Sure. Social media obviously is incredibly important, more so every day. How do we, for the first time, people have real access to decision makers all the time? And as a former decision maker, I know I was getting hammered 24/7 during the healthcare fight. Talk to us about how we can use social media to change outcome and begin to have a bigger role in these debates.
Yeah, so there's two ways in which social media is dramatically changing the way media content is distributed to readers. So the first is, of course, technology everywhere blows up distribution channels. You talked about how it used to be ABC, CBS, and NBC, and now it's thousands of channels, right? Sure. So it used to be that if you were a journalist and you wrote something, or if you were a corporation, somebody covered you, and you wanted to write something about it, you would send a letter to the editor, and the editor would decide whether that letter to the editor is published, right? Now Twitter has completely democratized that, right? Another thing that happens now that's actually very important that a lot of people don't necessarily appreciate is the way Facebook and other social media changes are driving what people actually read. So for me at Forbes, one of the number one ways in which traffic is driven to our articles, our content, is through people on Facebook sharing those articles with their friends. Because that's how more and more people are actually reading the news now, is they're opening their Facebook news feed, and the 10 news articles that are being shared at the top there, that's what they read. And so that's driving a lot of coverage of what happens. And so it's being much more finely tuned to what people are actually interested in. And journalists are, if they're smart and successful, their success is being driven by how good they are at channeling, understanding what readers are actually interested in reading, which wasn't always the case.
Kristine, you're an expert in this world. Talk to us about it.
I definitely think that social media is a starting point for change, especially to the extent that leaders and decision makers are on it themselves. I have a recent example of a story that I wrote about the overusage of antibiotics, which is leading to bacterial resistance and an increase in infections like MRSA and C. diff. And I tweeted out my story like I tweet out all of my stories, and lo and behold, I get a tweet back from the director of the CDC, which I thought was really cool, to think that the director of the CDC was actually getting his media through this medium and responding, and so thus the conversation began. And so, certainly social media is bridging a gap that I think previously existed and is providing for more direct access to leaders. But I also think that in a very different sense, the way that patient advocacy organizations are using social media is really something that we can all learn from, because they're really the ones who are out there with blogs and patient forums and Twitter and Twitter chats, who are making this a world of their own, and it's also leading to some change, I think. I did a story about young adults with cancer also recently, and talked to a group that calls itself Stupid Cancer. And they're young people under the age of 40 with cancer, and they have a lot going on in terms of social media. They have a phone app called Instapeer, which basically provides patients with immediate access to peers with cancer. And so this is really, patients nowadays are going to other patients immediately. They're not making those dozen phone calls to healthcare providers that end in frustration. They're going to each other. Doctors and other healthcare providers are also communicating on social media through Twitter and email. And this is kind of, I think, revolutionizing the way that people experience healthcare and the way that healthcare is being delivered. So, and just to add on, that group, Stupid Cancer, evidently their efforts and other advocacy efforts have led to more formal changes, like the establishment of a professional oncology society for young adults and other changes, guideline changes, and so forth.
That makes total sense. Anyone else have a...
I'll make a comment on that.
Yeah, perfect.
To your point on social media, I've worked in newsrooms before where you're tracking very closely the views of every story that you write and how many social shares every story gets. And I think you'll find that the stories that draw a lot of interest are these catastrophic events that we talked about. So the cases where it's a 1 in a million chance. So we've had, just this week, a violence type incident, at a hospital, or a very rare incident, and people think that's terrible. I was interested, I read the story, that's terrible, but it doesn't get to the larger issues that Merrill brought up, that no, this is happening on a very large scale, and those types of stories, that message I don't think always comes through when we focus on the catastrophic events, and that's what shares socially.
One thing I would add is that Twitter has, and the people who are savvy about using Twitter have a far disproportionate impact on the activities of the people they're tweeting about than they might otherwise deserve. Because people are actually much more sensitive to the feedback they get on Twitter than perhaps the broader community actually would care about. So if you're good at Twitter and you're a patient safety advocate, say, and you're tweeting about some institution that you're not happy with, or whatever it happens to be, people will respond to that, and that, I think, is only going to grow over time.
Yeah, it's interesting your point about data. I'm a big data geek. I think data is the best empirical way to a true truth. But too often, this era of big data becomes really, really confusing for people who don't interact with data every single day and are trying to piece through this. Merrill, how do you think about explaining big data? You're obviously someone who cares deeply about this. And what is the role of journalism in explaining this huge mountain of data? Because I've started giving a talk that the era of big data is gone and the area of little data is here, trying to figure out exactly how to personalize it for each one of you. And you've been a real leader in this world.
Well, we've put a lot of investment into trying to use a lot of the data that's now out there up on our website and trying to bring our own organization into the modern era in that regard. As has been talked about at several points today, I mean, we have more information about what's going on in hospitals today than we've ever had before. Most of it is published up on Hospital Compare, and then you have, today, they just did a huge data dump. Dialysis Compare, so every dialysis clinic is out there. The real question is like, how do you create the proper interfaces so that it's useful to people? We had some talks about grading systems. You know, people want to know about their own hospital, their own doctor, or whatever. I get all of that. We come at it from the issue of how do I make this data usable to the people who are actually running the institutions, because that's our primary audience.
Yep.
And even that's a very interesting question, because when you go into Hospital Compare, for instance, you can't find like every hospital in the city very easily. They haven't created an interface for that. Well, we're trying to create an interface for that. So how do I benchmark myself against the others in my immediate market? Those are the kind of questions that we're trying to say, how do I answer that question? How do I put up a database? And in fact, we have that up on our database now. We just put this up a couple of weeks ago because you have all of the readmissions penalties, you have all of the value-based purchasing, either rewards or penalties. You have the hospital-acquired conditions, what the hospital score was. We have all of that data for every hospital for all 3 years. Only the hacks are only for 1 year now. But we now have that up on our website where you can go in there and take a look at it. Not only that, you can say, let me look at every hospital in my city. Let me look at every hospital in my county. Let me look at every hospital in my state. So what we're struggling with, because you know, now you get into like the data visualization, and what is the proper user interface? These are not skills that journalists really have, so you got to learn them. And you know, believe me, I'm not the youngest person on this panel. I think I can safely say I'm the oldest person on this panel, but I'm struggling to learn new skills, and I'm seeing the young people in my staff having to do the same thing to figure out how do we use data in creative ways to reach out to our audiences. It's a very, very difficult job.
Lindsey, how do you view your role in trying to explain this data?
So I think, you know, when I think about getting this type of data, if you think about in the patient's hands, someone like my mother who doesn't understand it, to make informed, actionable decisions about healthcare, we have Hospital Compare. It has its drawbacks. It takes 3 years to refresh that data. That's one issue the American Hospital Association has with it, because if hospitals really make efforts to improve, it takes a long time before a patient would ever see that. But I think the larger issue is, you know, is that media's role, and are we going to be the ones to really affect that? So we're doing things now to make that more accessible, more user-friendly, and that's great. In the long term, are we going to be the ones to make the change? I don't think so. I mean, there's venture capitalist-funded startups out there that are doing this and are doing it well. They're targeting employers. Leah Binder mentioned earlier, you know, $39,000 just to treat an SSI. When we have tools that we can get that data to employers and then they can get it in their employees' hands, that's going to put some of these ratings, they're not going to be necessary. Now, we're not there yet, and so media needs to play a role in the interim. But we have tools. Castlight Health, I believe, was the largest IPO last year. They announced, I just learned over lunch, a deal with Leapfrog to integrate their ratings in there. And so as we get more data on that, that'll be really valuable and help people make decisions. There's a huge issue about physician data. I mean, we just don't have good physician data, so that's an area that needs improvement. If you look at Physician Compare, you will see a check mark. And if they turned in data, they get the check mark. They could be the worst physician with the worst outcomes in the country, but they would have that check mark. So that's an area that, you know, certainly the media could advocate for more light there. The government is collecting that data, it just hasn't been released yet.
Avik, you write for a publication that famously loves its data. What can advocates do to help you tell the story in a way that makes sense of all this?
It's a great question. So I think, you know, what we've been hearing about, one thing that's important, I think, to understand is that journalists are fairly good at telling a story about a specific situation. The VA hospital where there's huge waiting lists and the vets can't get the care. That's a story they can tell. But to actually take a gigantic amount of data, as Merrill said, that's really hard. What we often rely on are the think tanks, the academic centers, the literature, and sometimes the private sector where people are compiling this data. Of course, the Castlights, the Innovalons, the insurance companies who are actually doing pretty sophisticated analytics on this stuff. That's usually a trade secret for them. It's a competitive advantage of that for them. They're not usually releasing that data into the public domain. And they play a big role in actually, I think, driving behavior. But so does, of course, CMS. So there is a role for the public sector in disclosing this data. I think the more that people can compile that data in reports, if it's a 50-page or 100-page report, I can read that. But if I have to go on the website and figure it out all myself, that's really more of a think tank or academic job than it is a journalist job. The journalists are really very rarely positioned or have the bandwidth to do that kind of work.
Arefa, how do you think about using data and trying to explain the story?
Well, I think that we have to use that data, but we have to put it in a language that our readers can understand. And whether we're talking to people in the industry and we can really crunch those numbers, or we're translating it into information that your regular person on the street can take and say, hey, these check marks have meaning, and I can make a decision based on that, versus having to really get into the information and understand what, they just turned in the data and they got a check mark? So there's a lot of new ways, and with technology, it's amazing how we can get information to our consumers. Whether it's an article on a website that's news-based and followed on Twitter or Facebook, or if it's an interactive tool or an assessment or a quiz, a fun way to get the information, but get real credible information, or a live chat. I mean, there's a lot of methods now for the media to really work with the consumer and get them involved, get them engaged. The live chats are fantastic. I mean, you're sitting at home and you get to speak with the experts, you get to follow the whole conversation. You don't have to fly across the country to attend a conference. So I think that's really another angle to look at for getting patient safety right in the forefront, so people realize that it's a part of their everyday life. They have a right to kind of know this information before they walk into the hospital or the doctor's office.
Mm-hmm. So I'm going to go to some questions. We have some great questions. Carol Gunn has a question that I'm going to throw to Diane. Can a patient harm story push hospitals to become more transparent?
Definitely yes, but I think that we have to separate two things. First, the one-on-one medical practice, where doctors and medical staff are definitely our everyday heroes, and the patient safety, which is a public health issue. And when it comes to this situation, in order to be able to communicate patient safety issues, we need to make medical staff and doctors our heroes, patient safety heroes. And for this, the management of institutions, medical institutions and hospitals need to create awards for these doctors that don't commit errors, where the staffs do everything it should be. So in order to we as media be able to communicate that, and not only communicate catastrophic things. Most of the times, doctors are not used to be on the accused seat. They are the heroes, and yes, they are our everyday heroes. But when something goes wrong, they are not used to be on the accused seat. They don't know what to do. So when a hospital has transparency and reports a situation, that unfortunately not always happens. It happens sometimes in some hospitals, but not everywhere. And of course, if we take globally the whole world, it's not very common, unfortunately. So we need governments to be involved in all patient safety issues. So we as media have that data that we were talking about from the official site. So we can really have that official information from the government.
Your point is interesting about the community and getting awards and having good examples of success. there's been recent work by MIT Media Lab showing that incentivization doesn't really work. What really works is social pressure and social conditioning in your community, seeing good examples among your friends and your neighbors about what they're doing to change your behavior. That's why The Biggest Loser, my favorite show on television, is a huge success, because people see that community trying to change its behavior, and it makes a really great point. Kristine, how do you view all this?
Well, I definitely think that social pressure at a local level should and can come from local stories. I think that local reporters really have a large role in this, even though we all know in the media industry that local newspapers is kind of a dying art. But I think that a lot of that investigative watchdog reporting that can make change does have to start at a local level, because you read a story about your neighbor and that's going to mean a lot more to you than reading about statistics or reading about a policy in the abstract, or even something that takes place in another town. And I think that environment locally creates the kind of pressure that can lead to change, locally at a state level and then filtering upwards. So I really think that, local reporting, investigative reporting is partly where it's at to create that kind of pressure.
Merrill.
Yeah, Jim, we got feedback from the readers when we went through a magazine redesign that said they were really interested in best practices. These are people at hospital officials. So it's always interesting this is the second year in a row I've come to this conference, there's always this sort of an undertone that the media doesn't cover the safety issue. But when I look back just recently at our whole first year of our best practice feature that we introduced into our magazine, 3/4 of the articles that we ran, and it goes every other week, so we're talking 3/4 of 26 articles, thereabouts, were about patient safety issues, trying to highlight best practices for people working in hospitals that had a problem that they needed to confront, and we gave them a concrete example from a place that had shown some success in improving their operations. So that's how we sort of did the community, showing people in the community, in this case, hospital leaders and hospital organizations, people who are tackling the situation. Now, there's still tremendous room, because journalists are who they are, to find the disastrous situation. And the question is how do you cover the one-off disaster? I really liked it that Dr. Dupre in the Joint Commission, in her presentation, she just flashed this slide up there very quickly about a hospital fire, patient fire in a surgery down in North Carolina. Well, in fact, we put this in our cover. Interestingly enough, it's funny, I brought these up here.
Good plug. Right? Nice job.
A beautiful cover where we
also available on social media. Go ahead.
So, when we did the story, we just didn't cover this one situation in North Carolina. We looked at the whole issue of hospital fires. We found that there were about 200, surgery room fires. We looked at the cause of them. We had, the ECRI, which is a group that has always had this on its watch list, what the guidelines were. We did a story that looked at why these guidelines had not diffused through hospital, why people were still using alcoholic preps, for site cleansing before they would bring out the electric cauterizing gun, which would cause the patient to burst into flame. So, people were just doing bad practices out there. And so this was sort of the negative, if you will, but a great feature story from a journalist perspective, right? And an illustrative of what you shouldn't do. But at the same time, we really try to offer readers what they ought to be doing.
And your best practices, was that from just the last year you started doing this?
That's right. Well, actually, it started in October of 2013. That's when we relaunched we gave a whole new look. So at the same time as we were doing a look and feel, magazines go through this all the time.
Sure.
At the same time that we did that, we also took a close look at our content. And we said, what do we need to be doing different that we didn't used to do in the past, but we want to do in the future, because that's what our readers are asking for. And what hospital officials were asking us for is we want best practices.
I still think Joe's going to count that as a commitment from last year's summit, so we'll just go ahead and give you that, Merrill. Diane, I have a great question from Bernadette, which is, how can social media help bridge the information and power gap for social media and economically disadvantaged community like the Latino community?
I think today social media is getting more and more common, and social media is the way information gets to you instead of you reaching for the information. And social media can help enormously in order to create this change that we really need to create. And through social media, we could finally get a governmental institution where we as media can turn in order to communicate.
Yeah.
I think definitely joint commission, of course, is very important, but what we need is from government a commission when it comes to patient safety for the media and for everyone.
So I don't know who Debbie Robertson is, but she's asked the best question I've seen. So there only used to be 3 news sources, but they had high credibility. Now a social media consumer can get incorrect advice every single day. Look at the recent measles outbreak because people were scared away from vaccinating their children by uninformed celebrities. Shouldn't media be self-policing? So...
I'm going to do the unpopular thing and completely disagree with the premise of that question.
All right.
I actually think that the
quality
of the media is way better. It's more distributed, perhaps, but it's way better than it was before. In the old days, you had these 3 networks. You had, the New York Times or whatever. And if the New York Times is wrong about something, maybe they publish a correction on page A16 a week later. Today on the internet, a guy like me, if I write something and there's some analytical or factual error in it, my Twitter fans, particularly the ones who are slightly on the other side of the aisle, are all over me right away, and they make sure that I get that right, or they will just bury me, right? And I tell my writers that all the time. We are extremely concerned about making sure that we're accurate. Now, that's not all media institutions are as oriented towards that. Not all journalists care about their credibility that much. But there is much more accountability because of Twitter, because of the internet, in making sure that high visibility journalists are much more responsible, much more accurate. And I think you're seeing that. You're seeing actually more traffic going to higher quality, credible sites that actually do good journalism. And I think that there's a way to vet that in a way that there wasn't before. There's a democratization. Before, if CBS got something wrong, oh well, you're still going to watch CBS the next day. Today, if a site loses its credibility, people will go somewhere else.
But Jim, I got to disagree.
I got to disagree.
Harpa, go.
But my take is different, and I think my audience is different. We're talking about a lot of people that are savvy with social media, who are staying up, want to know what you have to say, and can counter it, go back and forth. The audience I'm looking at, they just want to know what their health condition is. They want to understand what is going on with that. How do I get support for what's going on in my life? How do I talk to my doctor and not get afraid? How do I remember to ask these questions because I get confused when I'm in the doctor's office? That population, the majority of them are now looking at health information sites on mobile and trying to scroll through information and figure out very complex topics in a few bullet points. Luckily, my site, WebMD, is one of the main places they go to, and I can proudly say it's credible, but there are a lot of sites out there that aren't like that. I actually gave a talk at the National Patient Care Conference for scleroderma patients, patient education conference for scleroderma patients, just a few months ago here in Anaheim. And I was really talking about the very basics. How do you open up Google, put in a search term, and understand all the choices that come up? How do you tell what the advertisements are? How do you look at the last 3 digits? Is it a .com, a .org, or a .gov? When you open up your article, is there a date? Is there an author listed? Can you tell if this is actually a sales pitch? We went through a lot of safety issues with social media. Patients don't know not to put their first name on there. They get on community boards, start talking about all sorts of personal issues. They're communicating back and forth. They're having great conversations with wonderful people. Like in particular, the scleroderma community, there's not many of them. They may have to speak to someone on the other side of the country. But there are then the troublemakers that will get into these sites and really take advantage of these people. So I do feel like we really have to think about the whole audience out there. And take care of them, and really, when credible sites and credible organizations like ours, we should be able to put up there that, hey, this is why you can trust us, because we've got a source box clearly listed. You can go to the primary source yourself and double check what I wrote. So.
Let me just also weigh in on a different aspect of why I don't think the self-correcting mechanism, I think that was one of the ideals of the internet and social media, but I think it has failed to a certain extent in practice, and it's contributed to what I would call the tribalism that we have in our country right now, where people look for self-reinforcing messages. Mm-hmm. So if I go on somebody's site, and let's talk about the anti-vaccine movement, since that's prompted the question.
Yep.
I can go on there and I can start arguing and trying to say, hey, wait, this is wrong. You people don't get it. You know, this is about herd immunity. When you don't vaccinate your kid, this is going to affect somebody else's kid down the road, et cetera, et cetera. But I'll be drowned out by the 400 people who have complete different point of view. And after a while, I would just simply give up. And then, therefore, that tribe will now have its site and its place and its networks. And I think that we're seeing a lot of that in medicine right now. And I think a lot of it is fairly destructive.
Eric, do you want to?
Yeah, no, I mean, are there people who put out, junk science? Are there people who actually talk about not taking vaccines? Of course. But WebMD, what's the audience of WebMD versus those sites? WebMD is one of the most visited websites in the entire world. Right, so if you actually look at the audience, if the goal of what we're talking about is to stamp out the existence of anyone who says anything that's scientifically incorrect, we cannot do that in America with the First Amendment. But what we can do is drive audiences to the most credible information. We actually do that very successfully. There are sites, and again, if your goal is to wipe out anyone who's saying anything wrong, yes, we'll never be able to do that. And if that's the approach, then you're going to be frustrated. But if the approach is, can we actually drive people to the most credible information? Yes, we can. The community can do that. The patient advocates can do that. The media can do that. Nonprofits can do that. The medical community can do that. And we do that. So I'm actually much more optimistic, and I think actually the quality of information, empirical information today is much better than it was before. And it's much more accessible to the average person. I'll give you some great examples. So back in my old days, I used to be a professional investor in biotech companies and healthcare companies in a past life. And one of the things that the internet changed was it used to be a new drug would come out that would treat a disease that used to be untreatable. And the physicians who specialized in that condition would not necessarily have always heard of that drug until a couple years later when the sales and marketing machine for that drug company started to go through. That's how it used to be. Then once the internet came, people would look up on WebMD. Okay, I've got some lysosomal storage disease. The parent finds out his kid has a lysosomal storage disease. He looks that up on WebMD, finds out there's a new drug that's been approved for that. The parent goes to the doctor and asks the doctor. So I find a lot of times the doctors are now much more aware of new treatment options because the patient looked it up on the internet. And that is actually a profound change that has democratized the distribution of advances in medical technology and cures and treatments, let alone patient safety. So I am absolutely not a pessimist. I'm an optimist about how technology is improving patient health care.
Lindsey, I got to get Debbie an answer to her question, though. Her question is, shouldn't media be self-policing? Well, you talked about the First Amendment, something I think is the most dear thing to me in the world. Europe doesn't have it, right? Journalists can be prosecuted. They can be taken in front of their own commission. So give Debbie her answer. Should you be self-policed?
Yes, I think the media should police ourselves. The problem is, how do we define the media? I mean,
right.
We have drug companies who can create, their content, and it may be accurate, and they are police.
But it can be very leading.
What?
It can be very leading.
Right.
So they go into the doctor's office and demand that, and it's difficult to have that discussion about what the true order of operations.
So, sure, I mean, there's various media organizations. We have guidelines around certain things. We could create guidelines and recommendations around healthcare. I don't think that gets at the bigger issue of message boards and other content that's out there that's not actually created by quote unquote, traditional media.
But these are different topics as patient safety, no? It's patient safety, but it's people safety. It's broad people safety, not really the patient in a hospital or facing a doctor. We are facing, as physicians, more informed patients, badly informed patients, unfortunately, and we have to face these issues as what is happening with measles now in California, starting in Anaheim, that people who don't take these vaccines. But when it comes to patient safety in the hospitals and all those preventable deaths that can be done and can be enhanced, and all these services that can be done properly in order to avoid a death or avoid a complication that would end with the life and the economy of a patient, it's a different thing.
All right, I want to change topics for a second. Part of the amazing patient safety movement is the stories. And you hear these amazing stories. I am a noted crier. I cry all the time. When I go to these meetings, people talk to me about the things they've been through, and they're heart-wrenching stories. How can the media, and Kristine, I want to pick on you on this, how can the media empower these patients to tell their story?
Well, I think at heart, the media traditionally is about giving voice to people without a voice. And maybe that's a romantic view of journalism, but I think it still holds true. And I think that patients, when they see themselves in print, when they see people like them, that's immediately a validating experience, and they're more inclined to voice their concerns and to open up about things that are going wrong. I can tell you that a lot of my stories begin with patient inquiries. I get emails from patients asking me to look into things. Most recently, a guy wrote me complaining about being discharged from the hospital too early, which can be a safety issue for sure. And so I'm going to be working on an article about discharge rules and what to do if you're a patient and you think you're being discharged too early, and that type of thing. So, I certainly think that the media is a wonderful platform for patients to feel empowered to speak up. And then, of course, in terms of social media, patients are all over social media. We know that through the forums and the blogs, and that alone is extremely empowering for a lot of them. But I still think that, for us journalists in the mainstream media, it's our responsibility to filter a lot of that and to, sort of stay above the fray, because patients, of course, are also doing a lot of venting on social media platforms, and to really get in the weeds and find the real issues and find the real stories, and then tell them with credibility and, a sense of responsibility.
Arefa, I want to ask, let me ask Arefa. WebMD has had real success in this, getting people to talk about this. Talk to me about how you view that and what you've done to empower patients to speak up.
Well, for me, my perspective with patient safety really boils down to the patient-doctor encounter. And I think it's fantastic, everything that's been going on today at the conference, because I feel like all the distractions and the errors that can occur around, those can be addressed by what's happening here at this conference. And what can come from this is that when the patient and the doctor are talking, they can actually listen to each other and they can fully engage. At WebMD, what my role is, what I really try to do is think about, what do I need that patient to know when they go talk to the provider or when they enter the hospital suite? What information is going to really allow them to ask the questions that are burning, so that they're prepared for what's going to happen afterward? And even as simple as understanding the symptoms involved, we know that for doctors, the majority of diagnosis occurs by the history. It's not all these unnecessary or necessary tests that are coming, having problems, and we have these patient safety issues. It's really the story the patient gives you in the office. So if I can help them understand how to really engage so that both parties feel like I got a really strong history, I don't need to cover myself with 3 other tests. I really have a relationship with this patient. They're going to come back and talk to me if this plan isn't right, and we can adjust things. That side can have the trust, and the patient can have the trust that this person heard me. They listened to me. they gave me this prescription. I think I'm going to go fill it. They want me to come back in 3 weeks and try this new method. I'm going to do it and come back. So, I mean, that's really where I see a lot of patient errors being saved. Because I think, as Diane was pointing out, I mean, as a doctor, I was in the clinic. I don't feel like I'm on one side with the hospitals and the patient is on the other side. I really feel like it's me and the patient and everybody else. And so helping that encounter, I feel like that'll really save, that communication will allow other errors to be caught and addressed quickly.
Yeah.
You started out with the questioner asks, how can the media be an advocate in a way for a particular circumstance?
Right.
But the reality is that whatever number we think of patient harm deaths that occur out there every year, and the numbers are 100,000, 400,000, you would think that people would be coming out of the woodwork every single day by the dozens with their stories to talk to people. And yet the reality is that you only get a couple over the transom. And I think that there's a hierarchy of what goes on. Most people, I suspect, don't know what happened to them. They really don't understand that a harm went on. So one thing that you've never seen in the mainstream media, now we're a trade journal, so I'm talking, I used to be in the mainstream media, so I'll talk a little bit about that as an institution, is that you never really saw pop up there the idea that there would be ombudsmen or Solve My Problem, a Dear Abby for hospital complaints or something, or physician complaints or anything like that. And one can, I think I understand the institutional constraints on doing some of that, because these are very major institutions in the city or wherever the media is located, and the doctors are a very powerful social force within that community. And then, if somebody is very aware of it, it now gets sucked into what happened to them. It gets sucked into a different system, which is the medical malpractice system. So now it becomes a court case. Now, journalists hear about court cases all the time. And we're asked to report on court cases all the time, except by the time it's in the courts, now you've got your classic on the one hand, on the other hand. Somebody lodged the charges, and believe me, the doctors and the lawyers and the hospitals are well lawyered up on their side to give you the other side about why that wasn't the case. So it's a very difficult job to find the perfect anecdote that allows you to write about a particular person's situation that then illustrates a broader trend. So my final prop for the day is a story that we did last June about the Cleveland Clinic, where the headline is Stonewalling Patient Complaints. I got over the transom, and I gave to one of my reporters a set of documents from a patient, happened to have been a military veteran, who had a very bad experience at the Cleveland Clinic. And it led to a 3-month investigation that basically looked at patient complaints. There's a system for complaining through CMS, right? We don't have a centralized system in this country. We don't have an NTSB to look into bad events or whatever. So but there is a complaint system, and Dr. David Antoon, who has become a patient safety activist, used it, and he brought his story to us. And we took a look at not just his story in the Cleveland Clinic, but we looked at the whole patient complaint system in the context of this story, and found out that, again, Cleveland Clinic wasn't alone. A lot of them, and some hospitals had worse records than others. The only coda I would say to this particular story is that we had been working on this for months, and the CEO of Cleveland Clinic had got mentioned in the press about being up for the job of running the VA after Dr. General Shinseki was thrown out because of his, the failures of the waiting lists. And we heard about that. We were almost ready to go, so we rushed into print. As soon as we landed, Toby Cosgrove of the Cleveland Clinic withdrew his name from being considered, and now we have a guy from the soap company who is running the VA. Hopefully he'll do a good job. But my point is just simply
that doesn't sound like an endorsement. That doesn't sound like you're endorsing that candidate.
I take a wait and see attitude about these things. But the point of the story is simply this. It's actually very difficult to take an individual complaint and turn it into a story, because it's a complex situation with a lot of different sides to that, and it takes a lot of work if you're going to do an honest job about really reporting that well.
Okay, last question. I'm running out of time, and this is our last one. I apologize. So is the media doing its job covering the stories that need to be covered in a public way that we can understand and act on? And what can we as advocates of patient safety do to help the media increase transparency? How can we help you? Avik, you go first.
Yeah, I mean, I'll go back to something I said before, which is that the more detailed research that the community produces that we can digest, that's important. Coming up with actual patient stories that highlight those policy lessons or those policy concerns, that helps because then again there's the hook for the story. But I'd say also finding out who, developing and supporting the journalists who are actually doing a good job writing about this stuff is very important. Because again, one of the things I think that technology has really helped is it used to be if you didn't work at Modern Healthcare, you didn't work at certain established institutions, those are the only people that could write about these stories and have the resources to do that. Now there are all these bloggers, and I guess that bloggers have largely a bad name in this crowd, but some of those bloggers have gone on to be extremely successful journalists because they were hardworking and they were diligent and they found those good stories. And so if you can identify those individuals, maybe they're working at some website you've never heard of, but if they're doing detailed write-ups of stories in patient safety or anything else that you find actually show that this guy actually gets what's going on, does the research in a real and credible way and thorough way, develop that guy, promote his work or gal, and you'll find that that will also help. Make sure that the people who are covering these stories well, that their work gets promoted and shared.
I like that awards for journalists. It goes to Diane's point about awards for local folks doing good work. Kristine, talk to me about your views on this. How do we help you?
Yeah, I think referring to something Merrill said earlier, I think more systematic coverage of these issues, more sustained attention, not just when something, the isolated case happens, would really help visibility. And I also think, as I said earlier, more local investigative coverage. I mean, the local reporters really have to be the watchdogs of public institutions. And I also think broadly that partnering with patient advocacy organizations, reporters need to be kind of embedded with the advocacy organizations. Constant conversations have to be taking place about what are really, the important issues. And I think that moving even beyond, we're all journalists, we all love telling stories, but I think moving beyond the good narrative to the really important issues is going to have to happen with the patient advocacy organizations.
Lindsey, how do you get these people to help you?
I like the first question you asked, which was, can we do more? And I would say trade journalism, absolutely. One thing that has become extremely clear to me from sitting on this background is that Merrill does not come from a trade journalism background, and that's why you're seeing stories like this, which is traditionally trade journalism is very different than traditional media in that we don't set the agenda. So we survey our members, or we survey our readers, we ask them, what are the top issues for you? I've covered B2B healthcare for 6 years. I've asked every CEO I've interviewed, what keeps you up at night? Not one person said patient safety in 6 years. That doesn't mean it's not an important issue to them, but as the top leader in their organization, it's not a key strategic issue. And so I think what we can do when we as journalists understand this is a fundamental issue, kind of take the reins a little bit and say, okay, this is something we as a news organization want to set the agenda on, even though that's not traditionally the path trade has taken.
Diane.
I think we have to measure what to say. We also, of course, have good stories to cover. It's difficult sometimes because some patients have a kind of Stockholm syndrome when everything went well finally, like the kidnapped, and they want to cover their doctors and all the health team and don't want to do anything to harm them. But we had recently the case of the governor of Mexico City who went to the hospital for a procedure, non-invasive procedure, and he ended up with open heart surgery because they tore his heart. So I had the opportunity to talk to the doctor, to the surgeon who saved his life, and he told me, I'm not allowed to talk. I tell you, there was a mistake, but I can't tell you more. The doctor who made the mistake didn't want to talk. Finally, I was waiting for the minister to come out from the hospital and try to find out what happened to him. And no, he decided not to do anything. He said he doesn't want to know what happened. He's happy that he's okay. So it's very difficult to find stories that will make the change. I thought this one was going to make the change in our country. Unfortunately, it wasn't like this. And when I wrote on the newspaper about that, doctors immediately got very upset with me, saying, how can you go against our medical doctors? And I didn't go against anyone. I just said, if when there is an airplane crash, you have a research to know what happened and what caused that. You need to do that for every patient that has gone through something wrong. We need just to know what happened in order to avoid it to happen again. So it's very hard for us as journalists, now sitting on the side of the journalists, to find good stories that are going to really make a change.
Merrill.
Well, Lindsey, I agree that this is probably what they said, but I think the reality is that when you now have a potential for a 3% 30-day readmission penalty on all your Medicare payments, and a 2% penalty if you didn't meet the value-based payment sort of criteria, and now a 1% penalty if you're in the upper quartile of or upper quintile of hospitals for hospital-acquired conditions, you've now lost up to 6% of your Medicare revenue. Well, you know, hospitals operate on these nonprofit hospitals on a 4, 5, and the best of them have a 6% margin. Excuse me. All of a sudden, you have real money at risk if you don't perform. I think that does capture people's attentions. So I think that the case that the patient safety movement needs to make, along with everybody who's concerned about this issue, is like, hey, if you deal with this problem, it'll actually save you money in the long run. Mm-hmm. It will make you not just a better place for healthcare, but a more financially viable organization. And the payment system is evolving too. We write about every day, every week, about how in more and more contracts between insurers, whether they're Medicare or public or private pay, the employers are going to risk-based contracts. We're getting much closer to a system where we're going to give you a bunch of money to take care of these people, and now it's up to you to make sure that that money goes far enough. Mm-hmm. Well, I think that in the long run, that's a good system, because what that's going to do is it's going to make you look at what you're doing. If somebody's going to come back in 30 days and you've got to still, then you have it in your interest to make sure that they don't. And you won't spend as much of that money they gave you to take care of that person. And so I think that the system is evolving to putting the providers more at financial risk, whether both penalties or incentives through things like bundled payments and at-risk contracts. And I think hopefully over time that will drive them to be much more concerned about this particular issue, because I do believe that it can save them a lot of money.
Save the best for last.
Well, I think basically the conversation is just so important that we can have it here and that we can be transparent and that I don't have to hide as a physician. If I make a mistake, we can talk about it. And for all healthcare providers, really. So I think the bottom line is that for the consumer, the atmosphere is really changing where it's out there. You can tell your provider to remember to wash their hands. You can read information that says, hey, well, actually, when you have a knee problem, there's this whole range of different things you can do. Why did you recommend this? What about these other methods I read? And that, I think, will help patients advocate for themselves to navigate this really complex, difficult journey and try to take care of themselves while we're trying to figure out the systemic changes.
As you all are trying to navigate through your difficult journey, I think the best way, I think we all would agree, would be to follow me on Twitter at Messina 2012 on Twitter, so feel free to do that. Let's give a huge round of applause to our panel. Thank you very much.